Hello, my name is Danita Hahn, and I am a pediatric hospitalist in the Department of Pediatrics, as well as a member of the Pediatric Residency Program Leadership Team. I'm excited to present to you today my Kinetic 3 Teaching Academy project. Of the 3 C's, I elected to look at character with a special focus on the character trait of leadership. My project is entitled Promoting Senior Resident Leadership During Handoffs, with special thanks to my mentor, Dr. Tab Ark. Regarding background, ensuring high-quality medical handoffs is important for the care of all patients, and this is particularly true for residents due to trainee work hour restrictions and the resultant need for frequent handoffs. There currently exists in the literature a lot of information surrounding medical handoffs and resident curricula that exist to promote safe and effective handoffs. However, most is related to those primarily giving and receiving the handoff as opposed to the supervisor of handoffs, which in medical education includes the senior resident. At our pediatrics residency program, our interns or PGY1s are the primary givers and receivers of handoff at the nighttime transition on the acute care ward teams, and we already have a handoffs curriculum addressing this cohort. Our senior residents, or PGY2s and beyond, who are on our ward teams, participate in handoffs as supervisors, but to date have not been the focus of our handoffs curriculum. As a result, the objectives of my project included performing a needs assessment in order to examine senior resident attitudes and opinions regarding their role during handoffs in our current state, and investigate senior resident practices as leaders and supervisors during the handoffs process. My methods included developing a survey for pediatric senior residents from all pediatrics programs, including categorical and combined programs, all of whom participate in the supervision of handoffs. This included 68 eligible residents. The survey addressed senior resident opinions about the supervision of handoffs, including their comfort level with supervision of handoffs, the role of the senior resident during the intern handoff, interruptions during handoffs, and opinions about necessity and benefit of handoffs training geared towards senior resident supervision. The survey incorporated yes and no, Likert scale, ranking, and free text questions. Data were analyzed using descriptive statistics, and free text responses were recorded. And I should note that this project was approved through the MCW IRB. Regarding my results, there were a total of 20 senior residents who responded to the survey, which was a 29% response rate. 60% of respondents stated they feel extremely comfortable supervising handoffs, and 15% stated they feel somewhat comfortable supervising handoffs. The remaining 25% had no response, so that means no respondents indicated that they were uncomfortable in supervising handoffs. When asked to describe the role of the senior resident during the nighttime intern handoff, common themes of responses included giving feedback to interns on their handoffs, seeing the big picture of the handoff, making sure the handoff is efficient, ensuring proper and pertinent information was conveyed and important information was emphasized, correcting errors and adding information when necessary, teaching junior learners about strong handoffs. 50% of respondents indicated they had modeled an ideal or strong handoff for their junior learners. And of those who indicated they had modeled a handoff, 90% felt like it was helpful for their interns. Additionally, 55% of respondents indicated they set expectations regarding handoffs with their junior learners. 55% of respondents indicated that handoffs were interrupted either sometimes, often, or always. And when asked to indicate the things that they could do to protect their team from interruptions during handoffs that they felt were the most challenging to do, asking attendings, fellows, or nurses who interrupt to come back or call back after the handoff was most frequently cited. Lastly, 40% of respondents indicated that they strongly or somewhat agreed that they would benefit from or be interested in training geared towards senior supervision of handoffs. So in conclusion, a dedicated senior resident handoff curriculum may be beneficial for and of interest to our residents. Based on survey responses, we can begin to create a list of qualities and behaviors that promote safe and effective handoff at the senior resident level and help them develop ways to incorporate them. Senior resident opinions captured in the survey can also be integrated into educational opportunities related to supervision of and leadership during handoffs. Regarding my entrepreneurial mindset, from a curiosity standpoint, I asked, what are our senior residents' opinions about handoffs and their role in the supervision of handoffs in current state? What qualities and skills in a supervising resident help promote a good handoff in more junior learners? And what are our senior residents' feelings on handoffs training for supervising residents? From a connection standpoint, I was able to connect with other members of the MCW Pediatrics Medical Education team, as well as medical education experts within the current institute, namely my mentor, Dr. Ark. And from a value standpoint, I was able to establish a starting point to allow for development of a new arm for our residency program's handoffs curriculum And I began to address a gap in the literature about the role of the supervising resident during handoffs and developing educational opportunities in relation to supervision during handoffs. Here is my character artifact, and thank you very much for listening to my presentation today.